this afternoon, I was tasked to uh, hold and discuss with you the tools of measurement, no? So I was told to explain about the rates, ratios, and prevalence. Okay, so let me share my PowerPoint. Okay, can the students see this?
Yes, Doc.
Okay. Please bear with me, class, because I am now in Dagupan City and it's raining hard, no? Hoping that my internet connection will be functioning well so that you will be able to understand me and at least understand what we are going to talk about regarding this afternoon's lecture. Okay, so at the end of our lecture or at the end of this lecture, I am expecting that the students should be able to at least describe, okay, what are the tools of measurements, no? So when we speak of tools of measurement class, we are talking about the rates, ratio, and proportion. And then I will be discussing also about some prevalence, okay? So when we speak of rate, okay, we are talking about the measures. We measure the occurrence, okay, in a certain event or particular event in a population that occurs during a given time, okay? So that is how are you going to uh, my headphone so that I could hear myself also. Okay, so when we speak of rate class, we are talking about the measures of the occurrence of some particular event in the population, and we are doing this during a given time of period. Okay, so if you're going to look at your rate class, okay, the measurement will comprise the following. So what are the things that you need to understand and look when you are looking at the rate. So the rate must comprise of a numerator, okay? And then it must possess the time or the specification time or the time specification. And then it also composed of a denominator and a multiplier. So these four indicators or this part should be your rates, okay, for you to call a measure that occurs of some particular event in a given population during a given time of period, okay? So when we speakily try to understand about rates, so we need to take note of the different types of rates. So we have your crude rates, okay? And then we have the specific rates and the standardized rates, okay? So please take note of the three types of rates that you need to understand during the entire lecture about the tools of measurement, okay? Now, we said that when we are talking about rate is something that signifies, okay, the speed or the frequency of the occurrence per unit time. So this is very important, class. Okay, so we could measure rate by using or knowing that it signifies speed or the frequency of the occurrence per unit time. And we said that the rate is defined as a quantity in one dimension that is divided by a quantity in its usually another dimension with an indication of time. Actually, if you are going to look at the definition, my first definition and the second definition are just the same. Okay, because the frequency of occurrence, okay, should be indicated by time, with a unit of time. Okay, and then as I said a while ago, that if you're going to look at the measurement of rate, then the numerator is always a part of the denominator. Are you with me, class? Do you understand? So take note that when you speak of rate, the numerator is always a part of the denominator. Okay? Now, an example, okay, I'll give an example. So when we speak of the annual incidence rate of an acute disease, So we said that in this example, we are going to get a numerator, which is about the number of new cases of that disease during a particular year. And then we are going to divide it with the estimated and average. Okay. Okay, class, please mute your phone if you want to listen to me. Please mute your phone.
Excuse me, Doc. You are muted.
Yes. Okay, so that is an example, a good example of the rate. Okay, now how about the ratio? So let's define the ratio and let's see how are we going to differentiate it from the rate. So when we speak of the ratio is the relationship of a size between two random quantities. Okay, and if you're going to look at the ratio does not include, or the denominator is not a component, okay, of the numerator. So the numerator is not a component of the denominator. Now, an example of this is the sex ratio. If you're going to look how many males, okay, is the ratio of males in which corresponds to the female ratio, okay, the sex and male and female ratio, and then the doctor population ratio. Let's say, for example, in Las Piñas, okay, how many doctors should be the ratio in a given population of Las Piñas, and the child-women ratio. Okay, now, if you're going to look at this class, the rates and ratio are key cornerstone in the understanding of health, morbidity, and mortality of population. So please take note of that, class. So we said that rates and ratio are cornerstone. They are very important, no? They serve as the cornerstone so that we will be able to understand morbidity and mortality of the population, specifically when it comes to the health issues. Okay, like for example, what happened during the COVID pandemic. Who is that? You want to say something? That one who is talking, do you want to say something? You want to you want you to be the one to explain? Huh? Okay. Now let's define proportion. When we say proportion, class, proportion is a ratio. And take note that this ratio indicates the relation in magnitude of a part of the whole. Okay? So like your rate, the numerator is always included in the denominator. And take note that when we speak of proportion, proportion is always expressed as percentage. So you will see a percentage mark. And it is said to be that proportion is a measurement of the size of a part out of the whole as 100. Now, if like for example that you will be able to get a very small, okay, a very small fraction, so the base can be 1,000 or it can be any 10 to the x, no? It is supposed to be 10 to the x, wherein x is above the 10, because I could not find when I was making this PowerPoint the 10 to the x ratio. So that's why I just put it 10 to the x. Okay. Now, what is about the numerator and the denominator? So when we speak of the numerator, class, no, take that when we speak of numerator, the numerator refers to the number of times event has occurred in the population during a specified time of period. Okay, so that is how are you going to define numerator. It is the number of times, okay, an event has occurred in a population during a specified time of period. Okay? And then when we speak of a denominator relates to the population. It could be a mid-year population class, or it could be a population at risk, a person and time and person to distance, or a subgroup of population. Okay, so this is when we speak of the denominator, this is the one that you put under the numerator. Okay, and then when you get the dividends of the two, then you are going to multiply. It's either by 100 or 1,000. So these are your numerator and denominator. Okay. Now, what is an indicator? So when we speak of an indicator class, it is said to be that the indicator is are variables that help to measure health changes. So whenever there is um, health changes that is happening in our environment, like for example, now we are not yet finished with COVID pandemic, no? But most of us, okay, are roaming around. We don't care. People usually go around, go to the mall and encounter so many people. And then some of the students, specifically, I was in Perpetual yesterday. I did not see any Indian wearing mask anymore. Okay. So that's why if there will be some problem, okay, specifically when there will be some changes in the health or changes in the health, okay, then this indicator will be able to help you to measure all the health changes, okay. Now, what could be a characteristic of an indicator? So when we speak of an indicator class, the indicator could be valid, okay. So when we measure what is supposed to be measured, then that is called a valid indicator. When do we consider that the indicator is precise and reliable? Okay, when we have the same results if used by different individuals in similar circumstances. So we say that an indicator is precise or reliable. Now, when is an indicator sensitive? Okay, whenever there are small changes, okay, small changes that occurs in a person's or in a community health status, then we say that an indicator is very sensitive. Okay, and then when we say specific indicator, we say that the indicator is specific if it only happens in a situation concern. Okay. And then indicator could be visible because an indicator has the ability to obtain data that we need. Okay. Remember that every time there are some problems, specifically during pandemic time, epidemic time, when there are a lot of diseases that occurs in a country, in a certain community, okay, then we need to always get the data, okay, so that we have something to report in our in the people of our community. And when do we say that the indicator is relevant? Okay, when the indicator contribute to the phenomenon of interest, okay, then we said an indicator is relevant. Okay, so recapitulate, an indicator should be valid, an indicator should be precise and reliable, it should be sensitive, okay, specific, visible, and relevant. Okay, so please take note, class, of the different characteristics or features of an indicator. Okay, so we will now proceed to the indices. Okay, what are some of the indices of fertility? That is very important for us to take note every time we are doing specifically in public health. So the first one is the crude birth rate. So we say that the crude birth rate is the measurement of live births per 1,000 per population every year or annually. So it is the live births per 1,000 per population per year. Now take note that the denominator here will includes everybody. Okay, it includes the males, children, and it also includes the postmenopausal women. Okay, now what about the general fertility rate? So we are going to get the live births per 1,000 women per year for women aged 15 to 44. Okay, so this is the general fertility rate. And then when we speak of the age-specific fertility rates class, this is the live births per 1,000 women per year in specific age bands. Take note that we use the age-specific fertility rates, okay, to take account into the different fertility patterns in different age groups. Okay, so please take note of some of the first three indicators of fertility. Okay, the next one, or the fourth one, is the total period fertility rate. So we said that this total period fertility is we measure the age-specific fertility rate that is expressed as live births per woman. Okay, and take note that the total period fertility rate is the average number of live born. Okay, different if current age-specific rates are applied over the 30-year period. Okay. Now, the total fertility rate class enables comparisons over time and across the countries. Okay. It also takes account of the different fertility rates within different age groups and provides a summary measure. Okay, so this is something about the total period fertility rate. Now, how about the cohort measures of fertility? So when we say cohort measures of fertility class, you're talking about the birth marriage cohort followed up until the woman is around past the age of 44. So this is an occurrence and timing of birth, and it is completed family size observed. Okay, so the cohort measures of fertility is an index of fertility that is used to predict future levels of fertility class. Okay, and take note that the cohort measures of fertility needs to take place over a long time. Now, if you're going to look at the different indices of fertility class, take note that all indices of fertility refers to birth at a specific period of time, okay? And most oftenly, okay, it occurs open in a single year. Okay, so please take note of these 5 indices of fertility. So again, these are your crude birth rate, okay? And then take note of the general fertility rate, specific age-specific fertility rates, to total period fertility rate in the cohort measures of fertility. Okay, so please take note of this indices of fertility. Okay, now what are some of the common factors that may influence the trends when we are talking about the different indices? Okay, so one of the very important factor that might influence the trends is, of course, the economic prosperity. Okay, and of course the employment level. So what will happen if there will be a lot of unemployment? Okay, most of the people are employed. And the next one is the marriage cohabitation patterns. And we have the socio-cultural factors such as sexual mores and practices. Okay, in every country, on every certain region, there are some several practices that they are doing. Okay, specifically knowing their cultural heritage class. Okay, so please take note of this. Even in your country, in India, there are some different practices that you observe. Okay, during the in your culture that you need to observe. Okay, and then of course the contraceptive availability and usage. Okay, some of the females are afraid to use some contraceptive because they were thinking that they might have cancer. Okay, they might have cancer, specifically to those people who are living in a very far-flung areas in the country, not only in the Philippines, but maybe also in your country. So and aside that they are living very far, okay, some health services could not reach them. Okay, they could not avail some contraceptive, okay, that is available. Okay, so these are some of the different factors that might influence, okay, the fertility indices. Okay, now if you're going to look at the types of indicators class, now talking about of these indicators that we have defined already, we said that there is what you call the mortality indicators, okay? And then we have also the morbidity indicators, disability rates, fertility indicators, the nutritional status indicators, healthcare delivery indicators, and utilization rates, okay? Now, starting with mortality indicators class, the first one is the crude death rate. Okay, so how do you measure the mortality, this crude death rate? Okay, so you are going to get the data that is referring to the number of deaths during the year, divide by the mid-year population, and you multiply it by 1,000. Now, what happens if there is a decreased crude death rate class? Okay. Now, a decreased crude death rate, okay, will provide a good tool for assessing the overall health improvement in a certain population. Okay. So, although the crude death rate lacks the comparability of communities or national level, because take note that there are differences by age, sex, and race. Okay. So there are different races in in reality. There are Caucasians, Indians, okay, Asian, okay. So there are a lot of Africans. So these are the different race that we have. Now, specific death rates. When we say specific death rates, you can get the cause or the disease specific death rate, and you are going to get the total number of population and multiply it by 1,000 so that you will be able to get the disease specific death rate. Now, how about the related to a specific group? So, when you speak of the specific groups class, either it is age and sex or both, and then you get the number of deaths and a specific age group, okay, divide by the median population of the same age group and multiply it by 1,000. Okay, now class, the specific death rates can help us to identify particular groups or groups at risk for preventable action. So this is very important class so that we will be able to know what are some preventable actions. Like for example, there is a case wherein there are some diseases that might be affecting female population. What are these or what is this type of disease? So that's why it could be related to the specific group, okay, sex related. So if a certain disease is only affecting the female, or a certain disease cause of death among males, okay, why is it that there are in a certain population there are a lot of males, okay, or death among males? What could be the cause? Okay, so we are going to get the number of deaths in that specific age groups to be able to know the specific death rates in a certain age, sex, or given population. So we were able to identify the particular groups or groups at risk for prevention or preventable action. Okay, like for example, maybe there are in a certain population, what they usually do is to drink alcohol. Remember that alcohol is not good to our body. Okay, so because of too much drinking alcohol, okay, among males, then what happened? They died early. Okay, now stillbirth rate class. So when we speak of the stillbirth rate, fetal deaths weighing over 500 grams divided by the total life plus stillbirths over 500 grams at birth, and then you are going to multiply it by 1,000. Now, how about the perinatal mortality rate? So the late fetal plus the early neonatal over the live births in same year times 1,000. Now, take note, class, that when we speak of this type of mortality rate, this one serve as good indication of pregnancy waste deaths. Remember that the stillbirth rate is not good, no? And even some perinatal mortality rate is not also good for a community. Okay, so it might indicate a good indication of pregnancy waste days, the quality and quantity of maternity care that is available to mother and the newborn. When there are a lot of perinatal morbidity or mortality and a stillbirth rate, so it might indicate that the maternity care to mother and the newborn are not good in a certain community. Okay, so because of this type of mortality rate, then we will be able to, it is a good indication of pregnancy stage, quality, quantity of maternity care that is available to mother and newborn. Okay, then, and also take note, class, that this type of mortality indicator will also reflect maternity care. So that's why it is very important that in a certain, or maybe the Ministry of Health or the Department of Health always give some good health services when it comes to a good maternity care. Okay. Now, the neonatal mortality rate. So, the neonatal mortality rate, class, is the number of deaths of children under 28 days of age in a year. Remember, class, that when we speak of a neonate is from day one, the moment the fetus is born, okay, up to day 28. Okay, so that is what you call the neonatal period. So you're going to get the number of deaths of children under 28 days of age in a year over the total live births in the same year, and then multiply it by 1,000. Now, what does a high neonatal mortality rate indicates? Okay, if there will be a high neonatal mortality rate, it suggests that the health status or the health department should improve antenatal and postnatal services to the expectant mothers. Okay, remember that this is very important, class, specifically that the pregnant woman should have their perinatal checkup, whether they are living in a very far region in the community. So still they need, okay, still they need to have a good prenatal and postnatal services. Okay, and then when we speak of the post-neonatal mortality rate, you're talking about the number of deaths of children between 28 days and 1 year of age in a given year, over the total number of live births in the same year, then multiply it by 1,000. So that is your post-neonatal mortality rate. Okay, now how about the infant mortality rate? So the infant mortality rate is the number of deaths of children less than 1 year of age in a year over the number of live births in the same year times 1,000. Now, you need to take note, class, that the infant mortality rate is the most sensitive indicator about health status and conditions in a given population. So please take note of that. So your infant mortality rate, again, is the most sensitive indicator about health status and conditions in a given population. So please take note of this, because in your exam we will be giving some data for you to get, okay, what is the infant mortality rate. So you need to remember the different formulas, okay, the different formula of the different mortality indicators. Child death rate. So the child death rate, class, is the number of deaths of children aged 1 to 4 years during a given year, over the total number of children aged 1 to 4 years at the middle of the year. Then multiply it by 1,000. Now, it is said to be that the child death rate is the most refined indicator, specifically regarding the social situation of a certain country. Okay? So it is the more refined indicator of the social situation in a country. So that is your child death rate. Okay? And it said that the child death rate will reflect, okay, whenever there will be an increase of the child death rate, then what will happen? It will be reflecting that there is an inadequate maternal child health services in a certain area, okay? Now, it could be insufficient nutrition. Remember that a pregnant mother should get a good nutrition to have a healthy baby or a healthy newborn. Okay, and also it could be secondary to the low immunization, okay, implementation, okay, or the low immunization coverage. So maybe those people living in the mountains or people living in a very different far-flung areas Okay, they could not go down to the city, or they could not go down to any health services, okay, to have to have immunization. So what is the plan of the communities to so that the immunization will be implemented properly? There are some health workers that will be visiting house to house. Okay, there are some areas here, specifically in the Philippines, wherein doctor we have here doctor to the barrios, no? So the doctor to the barrios will be going house to house, specifically those people living in very far places in the Philippines. Okay. Now, the under five mortality rate. So, when we speak of the under five mortality rate, it's the number of deaths of children, okay, less than 5 years of age in a year, over the number of live births in the same year, and then multiply it by 1,000. Now, the under five mortality rate class is very good indicator, and according to UNICEF, is the best indicator about social development well-being. Okay. So this is according to UNICEF. Remember that the age measurement of UNICEF always deals under age, okay, under 5. Okay, that is very important, specifically in the Department of Health. We usually get measurement of children under 5 years of age. Okay. Now, how about the maternal mortality rate class? When we say maternal mortality rate, then the maternal mortality rate is the total number of maternal deaths in a year, in a given year, over the total number of live births in the same area and year, and then multiply it by 1,000. Now, the maternal mortality rate class is said to be the fine measure of quality maternity services. So it means that whenever in a certain community or in a certain place, okay, there is only the mortality rate is very less, or there is a few maternal, the woman who just gave birth die after a delivery of the infant or the fetus, then it means that there are the maternity services is good in that place. The quality of maternal or maternity services is high or good. Okay, so it means that they are being taken care of whenever there will be a very low mortality rate in a certain place. But whenever there is an increased mortality rate, then what will happen? It means that the quality of maternity services is not good, or it's not being implemented properly. Okay, so that is one of the mortality indicator that is very helpful for measuring the quality of maternity services. Okay, now the sex-specific death rate class. Okay, like for example, as I told you, how come there are a lot of males dying in a certain place? So you are going to get the number of males deaths in a year over the median population of males and multiply it 1,000. Now, there is another indicator that is specifically for comparison, no? That is very important for comparison when it comes to the sex-specific death rate. So this is the death rate of a woman in a reproductive age group. So you are going to get the female deaths at age between 15 to 49 years. Remember that the 15 years and the 49 years is said to be the most fertile period of a female. Okay, so you are going to get the number of female deaths aging 15 to 49, and then divide it with a female population of the same age group and multiply it by 1,000, so that you'll be able to get the sex-specific death rate of women, okay, aging 15 to 49. Are you still with me, class?
Yes,
Yes,
doctor.
doctor.
Okay, fatality rate, or the case fatality rate. Okay, so you get the total number of deaths due to a particular disease, okay, over the number of cases due to same disease, and multiply it by 1,000. Now, in the case fatality rate class, usually the time interval is not specified. And when we speak of the case fatality rate, it represents killing by a disease. Okay, like for example, acute infectious disease, like what we have now. We have COVID pandemic, no? So the case fatality rate could also be related to virulence. And take note that this case fatality rate, as I said, is one of the very important indicator so that we could investigate, okay, what is happening in an epidemic time. Okay, so that's why this case fatality rate is very important, specifically during an epidemic period. Like for example, what we have right now. Okay, now the proportional mortality rates is the number of deaths due to a particular cause or in a specific age group per 100 or 1,000 total deaths. Now, the proportional mortality class is also a very good and a useful indicator within any population group of a specific disease or disease group as cause of death among women, no? So this is very important because this will be able to tell you the number of deaths, okay, the cause of death in a particular age, specifically a specific specified age group per 100 or 1,000 total deaths. So when we say survival rate class, the survival rate is the total number of patients alive after a period over the total number of patients diagnosed or treated times 1,000. So the survival rate is one very good indicator so that we will be able to assess standards of treatment or therapy. Like for example, there is a certain group, okay, a certain group whose tuberculosis maybe is very, very rampant in that certain area. Okay, then we will give some treatment, like for example, anti-TB drugs. Okay, so whenever there are some, does it show that there is an improvement in that specific area when it comes to the treatment that we gave? Okay, then we could consider the survival rate. Okay, to consider using the survival rate so that we will be able to use the standard form of treatment that is given. Okay, for example, during the time of pandemic, there are different vaccines that is given in certain places, no? Depending on the type of vaccine. There is Sinovac, Pfizer, what's that, Moderna, okay? There are a lot more. And then they are trying to observe, okay, the patients, okay? Those patients who receive maybe the Pfizer vaccination or the Pfizer vaccines, no? Is there any cause of morbidity and mortality when it comes to the use of this kind of treatment, okay, specifically after the Pfizer vaccination? Okay, standardized death rates class. So when we speak of the standardized death rate, okay, so this is used for the purpose of comparison between different populations, okay? So in order for you to get the standardized mortality ratio, we are going to get the number of observed deaths over the number of expected deaths and then multiply it. Now, if you're going to look at the types of standardized ratio, the standardized ratio could be direct standardization or an indirect standardization, okay? So when we speak of direct standardized death rates, it requires a local index population, class, take note. Okay, so we speak that it is direct because it requires local index population. Stratified is also required. It also requires an age-specific counts for the event of interest. It also requires a reference population for comparison purposes. So please take note of this is direct standardized or standardization. So take note of the requirements. So it requires local index population. It requires the stratified age-specific counts for the event of interest and a reference population for comparison purposes. Okay, so when do we speak that this standardized death rates is indirect? So when age group data required for direct standardization is not available then we use the standardized, or I mean the indirect standardization. Okay, so please take note of that class. So this is your standardized death rate. Okay, so after those indicators class, then we will proceed to prevalence. So when we speak of prevalence, prevalence refers to all current cases, whether it is old and new, okay, existing at a given point or period of time in a given population. So please take note of the prevalence. Okay, so it refers to all current cases, whether the case is old, whether the case is new, and these cases exist at a given point, okay, or it could be existing in a given period of time in a given population. Okay, so what you are going to do is get the prevalence. You are going to get the current cases existing at a given period of time over the population at risk. Okay, now you need to take note that the prevalence could be point prevalence, and it could be the period prevalence. Okay, so when is it that it is called point prevalence? So when we speak point prevalence rate class, point prevalence rate of a condition is the number of cases of that condition at a particular point in time or in a given particular population at risk at that point in time. So this is the definition of point prevalence. Okay, now how are you going to differentiate it from the period prevalence rate? So when we speak of the period prevalence rate class, it refers to the number of cases of that condition during a particular period in time or a particular average population at risk for that given period. Like for example, this 2021, okay, 2020, 2021, okay. So that period is said to be the period of prevalence when there is a very high death of mortality when it comes to COVID cases. Okay, there are hundreds, or there are even some countries, hundreds or thousands who died when it comes to the cases of COVID in a different country. Okay, so that is what may be a good example of the period prevalence rate. Okay, it depends on the number of individuals during that particular time of period 2020 and 2021 when there is when people are usually at risk and people are dying because of COVID cases, okay, or COVID infection. Okay, so how do we use, or why there is prevalence? So we use it to estimate the magnitude of disease and identify high-risk population. So that is one use of prevalence. Okay, it is also useful for administrative and planning purposes. Okay, so that is prevalence. And take note that prevalence will be depending on two factors. So what are the two factors where your prevalence depends? So they are the previous incidence and the duration or chronicity of disease. Okay, so please take note of the two factors where your prevalence should depend. So it depends on the incidence, the previous incidence, and the duration or chronicity of diseases. Okay, so that is how are you going to get the prevalence. Okay, now when incidence and a specific disease are stable, then prevalence, which is P, will be equal to incidence, or I, times the duration. Okay, now it is very important, class, to take note that prevalence will change in response to the following. Whenever there is a change in incidence, then there could be a change in the prevalence. Okay, so whenever there are changes in disease duration and chronicity, then there will be a change in prevalence. Okay, depends on the intervention or the preventive program that is being given. Okay, like for example, one of the good example to intervene and prevent spread of COVID is for the people to wear masks. Okay, so there are so many programs that the Department of Health or the Ministry of Health is trying to tell us. Okay, wash your hands for 1 minute, what else? Wear mask everywhere you go, social distancing, 1.5 meters each, okay? And avoid crowded places, okay? We are even told to avoid touching the nose and touch in any part of our body, okay, during the time when there is a very high incidence of COVID positive cases, okay? So those are some of the preventive measures to avoid, okay? And then selective migration of cases, okay? Like for example now, the case in China, okay? And so what some of the countries are doing to prevent migration of these diseases. So they try to hold or what you call this, uh, prevent the entry of people who are coming from China to enter a certain country. Okay, so these are some of the selective measures to avoid migration of cases. Okay, changing classification of cases, whether they are active or arrested cases. Okay, so this all of this will be some of the changes that may occur whenever there will be this will cause a change in the prevalence. Okay, whenever there are these changes happens, so that there will be a change in the prevalence. Okay. Okay, so what is disability rate? So when we speak of disability rates class, this is actually an event type indicator, no? And then like for example, when you are disabled, when you are in the hospital, when you stay in the hospital, okay, the bed disability days, how many days you stayed in the hospital, okay, or the number of days restricted ability activity, wherein before you always go to play what you call that cricket, and then your doctor that allowed told you not to restrict yourself playing cricket because you cannot do that because you are disabled. Okay. Now the person type indicators is there is limitation of mobility and limitation of activity. So these are your disability rate. Okay, nutritional status indicators. So when we speak of the nutritional status indicator, it is very important to get the anthropometric measurements, specifically of the preschool children. Okay, so we are going to get the weight. Okay, we are going to get the weight of these preschool children, the height, the mid-arm circumference. Okay, so what is the prevalence when there is a low birth weight? So whenever a child is weighing more than, or I mean less than 2.5 grams, then the prevalence here is a low birth weight. Okay, so these are some of the nutritional status indicators. So what is utilization rate? So when you speak of utilization rates class, this has something to do with the utilization of services or the actual coverage of services. Okay, so it could be expressed as the proportion of people in need of a service in a given period. Okay, so this is the utilization rates will be based on the those people in need, okay, of a service in a given period of time. Okay, so like for example, the proportion of infants fully immunized. Okay, what is the proportion of infants that is fully immunized in a certain population? The percentage of population using different methods of family planning. Okay, also the bed occupancy rate in hospital. Okay, during the COVID pandemic. Okay, the bed occupancy rate are always 100% full. Okay, so most of the people could not be admitted to the hospital because the occupancy rate is 100% occupied, so they could not get some health services that they need. Okay, and also utilization rates might be also depends on the average length of stay in a hospital. Okay, so these are your utilization rates. Okay, social and mental health indicators. What are these? So whenever there is a very high suicide rate in a certain place, okay, or it could be a case of a homicide cases and a violence and crime in a certain place. Okay, so these are some of the social and mental health indicators. There could be some high incidence of suicide because people are so depressed. Okay, so there are always depression that happens. Okay, so that will indicate a social and mental health indicators. Road traffic accidents. Okay, so what could be the main problem? Why there are so many road traffic incidents? Maybe the driver is drunk, or maybe there is no pedestrian line or pedestrian lanes. Okay, or the people do not know how to follow the stoplight. Okay, they try to cross the road when even when the stoplight is red. Okay, so those are some causes of the road traffic incidents. Juvenile delinquency. Okay, so juvenile delinquency is also a very important, okay, that is needed to take note for the mental health. Okay, there might be usually the main cause of juvenile delinquency is their past experience, no, the past experience or any problem in the family. Okay, so it could affect the mental health of that young individual. Okay, alcohol, drug abuse, and smoking. Okay, so take note also of some of this indicator. Obesity is also one, and also the family violence. No, so are there any violence that occurs in a certain family? Okay, then we need to have the social and mental health indicators. We need to come up with some strategy. Okay, like for example, the mental health program in a certain community, so that these cases of juvenile delinquency, suicide, and family violence could be avoided. Okay. Okay, environmental indicators. So this is also important class. Okay. Now it will be reflecting on the physical and biological environment of a certain place. Okay. So why is it that there is pollution of air and water? Maybe the people just throw their garbage, okay, in the rivers, okay, or they do not know how to dispose their garbage properly. So what will be the result, or what will be the consequence? There will be pollution of air and water. Okay, the presence of radio radiation and noise, no? So this is also very important as environmental, to have our to take note of this environmental radiation and noise. Solid waste, no? Maybe a certain family household does not have a toilet. So what are you are going to do? How are you going to solve the solid waste? And then exposure to toxic substances. Okay, so we need to take note when or where are we going to dispose the toxic substances that we might have, okay, and use. Okay, so I think that is the last slide that I have with you this afternoon. Do you have any concern or needs? There are some question, class, for you to clarify. Hello?
Yes, so
Is there any?
so
No,
Yeah.
that,
Okay, class. So, in my lecture this afternoon, you need to understand the different indices, fertility indices, and the different mortality indicators that I mentioned, no? So we said that you need to take note of the rates, ratio, and proportion, and the prevalence. Okay, so just try to understand them properly and try to understand the different indicators that I've mentioned to you. Okay, so some of the indicators are based on the indices of fertility, like your crude birth rate, general fertility rate, age-specific fertility rates, and the total period fertility rate in the cohort measures of fertility. And then I also indicate of some of the types of indicators, okay, when it comes to mortality, morbidity, disability, fertility indicators, okay, so that you will be able to understand. Now, class, you try to, what you call this, try to do some sheet work or homework, give, like, for example, try to get the crude death rate, okay? You give an example of how many deaths of people dying in a year, and then divide it by a major population, and divide it and multiply it by 1,000, so that you'll be able to understand the different indicators. Okay, so try to review this, and so that you'll be able to understand more. So do you have any question, class?
No, sir.
Okay, so if there are no questions, to the LOA, can you please take take the, what you call this, take screenshots for the attendance and send it to me? Currently, there are how many students present? There are 400.
Actually, Dr. Endis has told all the students to mention their names and USN on the comment section on YouTube, because there are 800 students and Zoom can't accommodate all 800 of them.
Okay.
So all the students will be mentioning their names on the YouTube video under the comment section to represent their attendance.
Okay, but be sure that all the students that will be sending their names are present today, for you to get the attendance. And please do not accept the rate of the students who are saying to be present, but actually they did not attend the class.
Yes, doctor.
Okay.
Yes.
Okay, so if there will be no questions, so that is for this afternoon. And thank you for attending the class.
Okay. Thank you, doctor.
Thank you, doctor.
Okay. Okay.
Thank you, doctor.
Thank you,
Okay.
Doctor.
Thank you, doctor.
Thank you.